I want to bring in the doctor who made this decision, a top doctor in Peel Region, Lawrence Lowe. He is the medical officer of health. Dr. Lowe, always good to see you. Big day, and I appreciate you taking some time for CTV News.
Well, thank you so much for having me.
All right, so why take this decision? Why now?
Well, I think there's a couple things that led into this decision. First of all, there's this strange 4-day short week in between the Easter long weekend and spring break, which we noted as a bit of an opportunity, especially in the midst of our community being particularly hard by the third wave. We're seeing cases and hospitalizations accelerate rapidly. And we do know that while measures taken in school generally keep that setting safe, we also know that the cases that get introduced into schools ultimately reflect what we're seeing in the community. So we thought, well, where we are with the third wave, we're actually already at levels which were the peak of our second wave. Now's the time to essentially put these measures in place, and also recognizing that the precautions are not 100% there. If we are at these levels, the hope is that by closing down the schools, by closing down the school community, making the most of this, remote over the next 4 days and the spring break, we can hopefully get to a place where we might be in a better situation later on in April, and also be able to keep our vaccine rollout going.
Dr. Lowe, you are responsible for the Peel region, as I mentioned, but Ontario's Chief Medical Officer of Health, Dr. David Williams, has said that schools remain safe, as you know, and there has not been much in-school transmission in the province. I'm just curious sort of how you would frame what he's saying versus what you are now saying for Peel.
So I don't disagree with David that schools are safe, particularly where the measures that we've put in place can continue to limit transmission from cases that might be introduced into that setting. But I think we have to recognize that when you get to a level of transmission like we're seeing in Peel, it becomes much more challenging, for our teachers, for our frontline staff, working through all the precautions, the PPE, everything, and then all the dismissals, automatic dismissals with every exposure that occurs. What's happening is more and more schools are closing, more and more classes are being dismissed. And it's increasingly hard for us in public health to keep up because there's just so many exposures that are occurring in schools. So yes, schools are safe, and yes, the measures that are in place are intended to keep staff and students safe, but it is becoming increasingly untenable at the level of transmission that we're seeing.
We also heard, as you know, from the Education Minister, Stephen Lecce, provincially, who said schools would remain open, but obviously not in the case of Peel.
Certainly, and I think to the extent that Minister Lecce and ourselves in the region of Peel share the same goal of continuing to keep open a safe in-person learning environment, knowing that children benefit from that, the hope is that if we act now and act quickly to stem any potential chains of transmission within the school settings from precautions and lapses and whatnot, and also to reduce community transmission as a whole by essentially keeping people home and then hopefully through the spring break, and everyone really needs to stay home, that's the big thing, then we may be able to return to in-person learning sooner rather than later, particularly as our vaccine coverage starts to catch up.
For parents who live in your region who are going to now say, boy, this is now confusing again, mixed messaging. The provincial government says one thing, now Dr. Lowe is saying another. What would you say to them?
I would absolutely tell them that, the provincial government, in terms of schools being safe with precautions in place, I agree with precautions in place. But there is also a threshold where at some point it's like driving, right? You can wear a seatbelt, and yes, seatbelts and airbags, they're great. But if you start driving at 400 kilometers an hour, it's, it doesn't matter how great the seatbelts and airbags are, there is a risk there. And I think that's what we're trying to forestall at this point in time, with the recognition that we're all in this really to try to make sure that our children can continue to benefit from in-person learning later on. Taking the measure now hopefully allows us to access that in the future.
And you were saying the closure should last, at this point anyway, perhaps until the 19th of April.
Absolutely, and we'll continue to be reassessing, obviously, the situation not only in schools but throughout our community to determine if we can start to reopen with confidence. And that will also take into account the spread of variants, the situation at our hospitals, and of course, the situation with our vaccine rollout, which we're really hoping will start to take off in the next few weeks.
All right, and before we go, I just want to tap into your expertise about this conversation that's now happening, and it does affect the Peel region, obviously, and other parts of Canada, where the question becomes, should we be reprioritizing other people? Should we be targeting different groups, different than what we're doing right now? As we all know, now it's largely by age. It's also by those most at risk in terms of health conditions. But I think about essential workers, Peel and other places in Canada, where, whether they're factory, whether they're teachers, they may not be in the right age cohort. They might be too young, but whether they are more at risk nowadays.
Well, certainly, I think there's ongoing discussions at many provincial tables around prioritization. When you're in a situation of vaccine scarcity, you really do want it to go to the people who are having the highest risk of severe and mortal outcomes. And while we are seeing more and more young people with variants of concern in hospital at this point in time, we do see the bulk of people that are still affected are usually people 60 and over. But once you start getting into a place of relative increases in vaccine supply, that's where you might be able to start having these conversations. And I'm certainly looking forward to seeing what the conclusion will be, especially as more and more vaccine starts to arrive in Canada.
Dr. Lawrence Lowe is the Chief Medical Officer of Health for the Peel region west of Toronto, announcing today the schools in that part of Ontario will close until the 19th of April at least. Dr. Lowe, thank you for this. Appreciate you taking some time, as always, for CTV News to get the word out.
Thanks for having me. I really appreciate it.